Hi everyone, and welcome back to the Sex Advent Calendar, 25 days of sex education all through the month of December. I'm Bianca again, still the owner of Intimate Health Consulting, and today we're going to be talking about genital health and hygiene. So anyone that follows me on Twitter should know that I have a lot of feelings about the trends in women's health right now, about things that you're supposed to do to keep your vagina fresh and young and healthy. When in reality, the most important thing that you can take out of this video is the fact that the vagina is a self-cleaning ecosystem. It is populated by a very beautiful, delicate balance of bacteria that make sure that the pH stays level and that the vagina stays healthy. So when you disrupt that with things like douching and putting hair dryers near your genitals, or steaming them, or other things that Gwyneth tells you to do in her Goop channel, please don't do that. It disrupts that delicate ecosystem, and it can cause infections like bacterial vaginosis, yeast infections, and things like that, because it throws off the balance of all of those bacteria. So you know that your vagina is healthy when the discharge that comes out on your underwear, which is totally normal, is thin and clear to whitish. So when it starts looking chunky or green or yellow in color, or it has an odor, that's when you think, something might be off, and it's worth going to the doctor and checking in to see what's going on. But a little bit of clear to white discharge is totally normal. The other thing to keep in mind is if you have diabetes, either type 1 or type 2, you are more prone to infections, specifically yeast infections, because of the increased glucose that's in your vaginal tissue. So you want to be really careful about what you put into your vagina, both lubricants and any kind of douches or other products that you might use on that area. My second tip for you is just to be gentle, regardless of what kind of genitals you have. There are a lot of products out there designed to make you feel bad about what they look like, things that are to be used to bleach them, or to pull the hair out, or to change the color or the shape of them. In reality, all genitals are beautiful genitals, and the variation that we see in their size, their shape, and their color is totally normal. So if you just take care of them in a natural way, washing with soap and water and making sure that you get into all of the folds, that's between the labia, under the clitoral hood, under the foreskin, and behind the scrotum, then you're going to be taking good care of them. And if you do wax or shave or use other hair removal products, make sure that you space those treatments out to give your body time to heal. It does cause irritation to the skin, and those bumps and bruises from your hair removal treatment leave you more vulnerable to STIs in the few days after a hair removal. One of the most common questions that sex educators like me get is, am I normal? And everyone wants to know if their genitals, if their sexual behavior, if their way of being in the sexual world is average. And the reality of the situation is everyone is normal and no one is normal. So we want to just embrace the variation that is natural in our bodies and in our sexual behaviors. I want to address a couple of specifics there. So some folks with penises will find that they get little white spots, usually on the tip of the penis, the glans area. Those are called penile papules, and they're totally harmless. They usually go away within a few weeks to a few months, and 70% of penis owners will have them, or some other kind of skin irregularity. Those things change size, and they change in number and change in color over time. The main thing you want to be watching out for is to make sure that they don't get painful, or if they have any kind of discharge or odor. Then it's worth talking to your doctor about. Likewise, the pigmentation, the amount of tissue that you have, and the shape of your genitals, be those the labia, foreskin, scrotum, penis, or clitoris, they're all normal. Everyone has genitals that fit their specific body. So the direction that your penis hangs, or the size of your clitoris, or the amount of fatty tissue in your labia, all of those things are what make you you, and they match your body and no one else's. If you're feeling self-conscious about the way that your genitals look, I'm including some links to galleries that'll give you a sense of the really wide variety of the way that genitals and breast tissue can look on different people. These are obviously very not safe for work links, so please don't open them on your work computer, but definitely take a gander when you have a moment, because they're worth looking at and really understanding how, when we're taking the judgment away from our own bodies, so many different kinds of genitals can look beautiful. If you have any other questions, feel free to send them to us, and I will include them in future videos. Thank you so much for tuning in. I hope this was helpful information for you, and definitely keep watching for more videos all throughout the month of December. And exciting news, I'm headed back to nursing school in the fall. So if you want to help me get there and cover my expenses while I'm in school for the next 2.5 years, you should head over to store.intimatehealthconsulting.com. There you can make a donation that will allow me to provide more sexual health content to the community for free and help me pay my rent and get my groceries while I am in school. Thank you so much for all of your support, and stay tuned.